Hi YouTube, it's Tuesday, so it's time for another TMI Tuesday Trans Q+A. Hi, I'm Dr. Rachel McKinnon, making gender make sense. Let's get started. First question, have you had hormone replacement therapy? Yes, I started about 5 years ago. The process for trans women, depending on what you would like, is you start with a testosterone blocker that, while your body still produces testosterone, it loses the ability to utilize it. So while it's still in your bloodstream, your body isn't responding to it. And then you supplement that with estrogen. And it's important to suppress the testosterone so that the estrogen has a chance to take effect. And then some trans women, although there isn't a lot of really good medical data supporting that this has any effect, but some also use progesterone. But yeah, so yes, I'm on hormone replacement therapy and I will be for the rest of my life. I do not produce many of my own sex hormones, so there it is. Second question, did your body fat percentage change because of being on hormone therapy? Yeah, so lots of things change, and your body fat percentage, but also the distribution of your body fat changes and is heavily influenced by sex hormones like estrogen and testosterone. And so flooding your body full of estrogen causes you both to increase your body fat, but also where it goes. So one thing being an elite endurance athlete is I get my body composition tested pretty accurately, somewhat frequently. One way that we do that is a thing called a DEXA scan, which is basically an x-ray for your whole body that can tell you your body composition. So for example, here's my last scan. And one of the really interesting things for us was the body fat percentage was fine. It's like 23%, and I've lost weight since then. But the distribution is very normal for females. So a lot of it around the hips and the butt, for example. So while many of the effects of estrogen were great for me, as an athlete, the gaining fat, not so much. Another thing is that it becomes a lot harder to lose weight. So that's the thing that many women experience. And part of that has to do just with the presence of more estrogen and the utter absence, in my case, of testosterone. Have you had surgery? Whenever I do this exercise for groups or classes, and I hand out these 3x5 cards where they can write anonymous questions, I always start filtering through the questions and I leave the surgery one sort of at the back, and then that lets me at the end of the question period sort of fan them out and show how many surgery questions there were. One of the interesting things for me as an educator is that over time the number of surgery questions has dropped. I don't know why that is, but it seems like people might be understanding increasingly why it's not an appropriate question to ask. It's super personal, and usually the people asking me are not good friends or close partners. So think of it this way. It's like walking up to a man and saying, so have you had a vasectomy? Or, do you have erectile dysfunction? Right? That's super personal, and you might get punched for it. So it's also like walking up to a woman and saying, hey, how many abortions have you had? Right? It's not a thing that we ask people. It's super personal. It's not important, right? You don't need to know what's in my pants unless we're about to have sex, right? So asking a stranger what their genital situation isn't super polite. In fact, I think it's flat out rude. So I never answer that question. Next question. Do your tattoos mean anything with being trans? I think this is one of my most favorite questions I've ever gotten. When I got this question a couple months ago, it really caught me off guard. I really, really like this question. So I have 6 tattoos, and some of them have to do with being trans, some directly, some indirectly, and others not so much. So my first tattoo is on the back of my hip. It's 2 Gerbera daisies with my older dog's paws, like the picture of the bottom of his paws. Gerbera daisies have always been my favorite flower, and I love my dog. So that one isn't so much to do with gender at all. Second tattoo. So my second tattoo is on my ankle. It's all my favorite candies. I like candy, kind of a problem as an athlete. So that tattoo doesn't so much have to do with gender at all. However, there is an addition to it. There is one candy on there that does have to do with being trans, but I kind of like keeping that story private. Third tattoo, I actually got the same day that I got that addition to the candy tattoo, and it's my shoulder. And I remember going into my friend, the tattoo artist, and saying, hey, do you have extra time today? And she's like, yeah. What do you want? I'm like, something pretty on my arm. Well, what do you want? I don't know. You're an artist. Put something pretty on my shoulder. And my girlfriend at the time said, just give her some butterflies and a flower. She'll be happy. And that's what I have. So I have butterflies and an orchid. I just like having pretty things on my body. I love how tattoos are sort of art that you get to wear. So I wouldn't say that that's gender related, unless, well, I guess butterflies are very often a trans symbol because of the whole metamorphosis thing. Fourth tattoo, sort of quarter sleeve, I guess. It's Alphonse Mucha's dance painting. I think this one does have to do with gender in a sense. So again, it's kind of literally wearing art on my body because it is a piece of art. The way I sort of like to explain it is I sort of wear my femininity quite openly. It is just an expression of who I am. And so in a sense, I wear my gender on my sleeve. So I like having sort of a representation to me of femininity on my sleeve. My fifth tattoo is a corsage on my wrist. This one I think is sort of trans related to me. I transitioned after high school, so I never got to go to prom the way that I wish I could have. So I never got to wear a corsage to prom in this way. And so this is sort of a nice happy reminder of what could have been. And then my sixth tattoo is a tiara on the back of my neck because I'm a goddamn princess. And that's just sort of playful. I sort of get called a princess all the time, sort of as a joke. I wouldn't say I'm high maintenance, but whatever. And so I sort of literally wear the tiara on my neck. Next question. So, are you technically a lesbian or gay after the transition? So, sexual orientations are generally best understood in terms of the gender that you are and then the gender that you are attracted to. And so, given that I am a woman and I am attracted to women, that makes me lesbian. If, as a woman, I were attracted only to men, then I would be heterosexual. If, as a woman, I'm attracted to men and women, bisexual. If, as a woman, I'm attracted to everybody, pansexual, so on and so forth. I happen to be primarily, exclusively attracted to women, so that makes me a lesbian. Although I've explained in a previous video, I am asexual, so I tend to identify as homo-romantic in that I will date women, but not so much into sex for me. Next question. What led you to make this decision to transition? Honestly, I figured it out, right? I struggled for a very long time, right? Starting around age 12, 13, puberty, thinking, and maybe knowing that I would be happier and better off as a girl, but it didn't really quite occur to me that being trans and like actually being a girl was an option. And all the sort of media representations that were available to me were things like representations on Maury Povich and Sally Jessy Raphael, dating myself, which were caricatures of trans women. And I saw them, I'm like, whoa, that's not me. It took me forever to sort of revisit the very possibility that I might be trans. And I just very distinctly remember that day where the moment that I considered that, oh, maybe I am a woman, maybe I'm trans, immediately I knew that that was right. And then within like a minute, I'm like, okay, time to transition. So what led me to the decision? Figuring it out. The final two questions go together kind of nicely. The first is how much money goes into the whole process of a gender transition, and how long does the process take? So I'll take these together. It depends on what you want to do. Things like name changes in Ontario, where I'm from, they cost, I think, $130, which I did twice, so that's $260 right there. But you also have to then, pay for a new passport, driver's license, all your identifications. That costs money. That's going to be another couple $100. New birth certificate in the right name, or if you meet the criteria to change your sex identification marker, then you've got to pay to do that. So that costs money. So that's just in terms of like a social transition, in terms of, getting a name change and identifications changed. It's very common for trans women to remove their facial hair permanently. That happens either through electrolysis, which is the older technology, slower, way more expensive, I think way more painful, versus what most people do now, which is laser hair removal. And, it takes a year or two. You're looking at $3,000 for that. It's not cheap. Some trans women get breast augmentation, some don't. If you choose genital surgery and your insurance doesn't cover it, then you're looking generally minimum $15,000, and it just goes up from there. For trans men, phalloplasty is prohibitively expensive and the techniques aren't as advanced. You're looking like $50,000. Then there's the doctor's visits, the blood tests, the medications for hormone therapy, and that is a recurring cost because, I'm on that for life now. Some trans people get vocal training, so you might go see a speech pathologist to change the way you speak. For trans men who take testosterone, that is partly done for them. The testosterone itself will deepen the voice, whereas trans women, estrogen does not change your voice at all. Any change to your voice, way that you speak, has to be sort of done yourself. If you think that like I'm pretending right now in the way that I speak, like this is just how I speak, it's kind of funny asking people, because, trans people, especially trans women, are often very nervous about their voices because it's one way to be outed as trans. The term we use there is clocked. So in like a moment of insecurity about my voice one time, I remember knowing that sometimes I talk in my sleep, and I asked the partners, like, so how's my voice sound when I sleep? And she's like, it sounds the same. Don't worry, go back to sleep. So some might go through vocal training, many don't. I'm sure that there are other costs, but they're kind of slipping my mind. Depending on what you want to do, it can be relatively cheap or super expensive. And then how long does it take for like hormones to sort of fully run their course and get you to your normal day-to-day? That takes 1 to 2 years. Generally, people will not perform genital surgery until you have transitioned for at least a year. Facial hair removal takes 1 to 2 years. Right? So all those sorts of things take 1 to 2 years. This is not a thing that people can just wake up one day and be like, I'm going to be a girl, and then off you go, right? It takes time. And then there's this sort of question of like, when have you ever arrived at your gender? I think for all of us, that's never, right? We're always trying to figure out who we are and how to be the woman we want to be, or the man we want to be, or the agender person we want to be, so on and so forth. I think you never fully arrive, but that's no more true of trans people than cis people. So how long does it take? It depends on what you're asking me, but for the most part, most stuff gets taken care of within the first 2 years. But again, that depends on things like access to money, access to time off from work if you need it. Okay, that's it for another TMI Tuesday. I hope that was fun. I hope maybe you learned something. If you have any questions for me that you might want to ask for another TMI Tuesday, leave a comment down below. Don't forget to like the video and subscribe to the channel for future videos. Thank you.